Hi everyone, my name is Nicole Mapes and I recently completed a research study on the relationship between muscle fatigue and electromyography amplitude for wrist flexors and extensors during an isometric contraction. Past research has indicated that EMG is able to provide measures of muscle recruitment in motor units and normalize the data using percent of maximal voluntary contraction for comparison purposes. By using EMG and percent MVC, studies have resulted in both an increase and decrease in motor unit activity during a fatiguing contraction. Therefore, I investigated further the relationship between muscle fatigue and motor unit recruitment in the forearm muscles. For my hypothesis, I expected that recruitment or percent MVC would increase for both flexors and extensors with fatigue during a submaximal isometric contraction. To begin the study, 8 subjects from the Regis DPT class of 2019 volunteered, leaving us with 6 males and 2 females with a mean age of 23 years old, all of whom fit my inclusion criteria. I prepared the skin for each subject by using a razor and alcohol wipes and placing the electrodes on the muscle bellies of the flexors and extensors on the dominant hand. 2 more electrodes were placed on the biceps brachii for grounding purposes. The subjects completed a maximum grip test in a neutral hand grip position using a hand grip dynamometer. For the study, the subjects maintained 25% of their peak force level until they fatigued or reached 300 seconds. Peak EMG and force values were recorded every 15 seconds and percent MVC was measured also. Means and standard deviations for percent MVC and force were used to create line graphs. The first graph shows a clear decrease in muscle activation of flexors and extensors over time, and the second graph shows that 8 subjects were able to maintain a relatively stable force around 25% of their peak force level. From the data, I was able to conclude that the decrease in muscle activation failed to support my hypothesis. However, caution needs to be taken as the data shows no correlation between muscle activation during fatigue for wrist extensors and a weak correlation for flexors. The results also failed to support 2 previous studies which indicated that progression of fatigue was accompanied by more motor units in order to maintain a consistent force level when there is evidence of a decreased twitch force in the active muscle fibers. The variation of results can be due to poor electrode configuration, tissue impedance, inexperience with the equipment and protocol, and the subjects failing to reach fatigue. The clinical implication of this study is that surface EMG is a safe and practical tool to use in the clinic. Hand grip measurements can indicate strength and functional capabilities of patients, and percent MVC values during contractions can help clinicians understand when working muscles fatigue to prevent injury. I hope you enjoyed my research study. Please check out my references for more information on this topic.